Always good advice. It is tough to acclimate right now. April, thank you. Happening now, Sonora Quest, Banner Health, and the University of Arizona. Those are some of the healthcare providers coming together right now to increase the number of tests, the antibody testing that can be happening in our state, right? Making those provided. The Department of Health is calling it a testing blitz, quote unquote. So if you think that you might have been exposed to COVID-19 and you want to know if you have those antibodies right now, you could start finding out as soon as this weekend if you meet certain criteria. So let's talk about that to find out how important this testing really is, what you'll do with that information. Maria is live this morning with Dr. Cara Christ, who, as you know, heads up the Arizona Department of Health Services. Maria, good morning.
Good morning, Olivia. And we talk about this testing blitz. Up to 60,000 people tested in the state of Arizona over the next 3 weeks. It's what we've all been waiting for. Dr. Chris joining me here this morning inside the Arizona Department of Health Services. The news came out yesterday about this expansion in testing. What does this really mean for people?
So what we're hoping is that we'll be able to increase access to testing for Arizonans. And so our labs have been telling us they have additional capacity. So we expanded the types of people that are able to get tested.
Can you be specific about the types of testing? The release yesterday was talking about antibody testing and then also diagnostic testing. What's the difference?
So there's two types of testing. So diagnostic testing is going to be the kind that's going to look for the presence of the actual virus in somebody. So it'll tell you if you have the virus right then. Antibody tests look for antibodies which your body makes in response to becoming potentially exposed or infected. And so that can tell you that if you've previously been exposed. We don't know a lot about antibody testing. We don't know if that shows immunity, but we're hoping to learn more as more of those tests come online.
Who would qualify for antibody testing?
So anybody could qualify for antibody testing because that test will just show if you've previously been exposed. We want to make sure, though, that Arizonans don't think that if it comes back positive that they're protected moving forward.
Some people want to know, how much is it going to cost them?
So it's going to depend on your insurance and where you go. What we've done is on our website at azhealth.gov/testingblitz, you can go pre-register, and each site has its own criteria.
Are you tracking exactly where people are contracting COVID-19 or may have gotten the symptoms from?
So sometimes we do. Sometimes we are able to go back and identify that it was travel related, or these people are what we call an epi-link, or they've had contact with a known case. But with so many that we suspect to be asymptomatic or not showing any symptoms, it's very hard to track back where somebody may have gotten COVID-19.
And then let's talk about a second wave. We heard you say a little bit yesterday about it, but is Arizona going to see a second wave of coronavirus, and are we prepared?
So we may see a second wave of coronavirus. What we've done with our mitigation strategies is in order to protect our healthcare system, we have spaced out the cases. So we do anticipate that as things start opening up and as the community starts coming back together, whenever that is, we will see a rise in cases because we know COVID-19 is still out in the community.
And last but not least, the CDC just released some new symptoms, 6 new symptoms. Can you talk a little bit about that and what that means for people at home who are surprised?
So what we're learning new things every day about COVID-19. So CDC has done a lot of studies and has identified that there may be additional symptoms that people may experience when they have COVID-19. And that can include headache, chills, sore throat, a new loss of taste or smell. And so if you have symptoms that you think may be compatible with those, we would recommend calling your physician's office before going in so that you don't expose other people.
Okay, but as far as these testing sites and the ramped up number of testing, if they have any of those symptoms that you just listed, they could potentially be qualified.
So yes, so before we were requiring specific symptoms in order to get testing because of the very short number of supplies that we've had. We have heard from our commercial labs that they have more capacity and they have the supplies. So we actually updated our standing orders here at the department so that anyone who thinks they've been exposed and infected with COVID-19 can get tested because we know there are asymptomatic people.
And to be specific, it's diagnostic testing, not antibody testing?
So right now it is diagnostic testing. That's what we challenged our partners to bring on, but we challenged partners such as Sonora Quest. So we're hoping maybe they could also, if they wanted to offer the antibody testing at the same time.
Okay, well, thank you so much for the clarification. There was so much information yesterday in that release between antibody testing with Sonora and Quest Laboratories, the U of A. I mean, it was just so much information to sift through. So that's why we do these interviews with you to clarify. And that's what's happening here on Good Morning Arizona. If you have any more questions, of course, send that in to us so we can ask Dr. Christ the next time that we see you. Back to you, Olivia.
Maria, Dr. Christ, thank you so much. It really is helpful to get that clarity straight from the source, the head of the Department of Health Services here in Arizona. Appreciate it.